Hi, I'm Greg. I'm 12 days post-op from rotator cuff surgery. I'm no new guy to surgery. I had 2 years ago total knee replacement surgery, and that was so painful, the worst pain I've ever had in my life. But I was on opioids, those kind of things. But this time, I was on a new FDA-approved drug called Journavx. And it's only been 3 or 4 months now that it's been approved, so I guess I'm one of the newer patients on this. I don't know. I didn't do any research. I just did what the doctor said. My pain levels are 0 to 1 only this whole time. Maybe the first night a little uncomfortable. I'm sleeping in this recliner at night because it does. You roll over, it makes you, wake up because something happened over there. But the pain is not. I keep waiting for the other shoe to drop. Like there's got to be more pain than this, but there's not. This is. I'm not a doctor, but ask your doctor about Journavx. It just got approved. You want this product.
So, Dad, you're telling me that on a pain scale of 0 to 10, you've been like on a 1. I would say only the first day you answered me like a 3.
Okay.
But the huge impact I've seen of this medication compared to your knee surgery is the side effects have been so different. In fact, would you think there's been any?
Jordan, there are no side effects. I feel as sharp as can be. I'm not constipated. I'm eating well, going to the bathroom well, feel sharp. I'm not driving because the doctor hadn't approved it yet since I'm only 12 days out. But I feel like I can do all of these things. I feel complete. This is amazing. I can't understand it. I don't have words to describe it. But if I have any more surgeries, I am going to insist on this product.
Well, the biggest thing that I've seen, not just the pain difference, because even on the opioids, you were in so much pain. It was unreal. That was a totally different surgery. But even so, the lack of pain that you've been having this time is incredible. But I hate to bring it up, but last time with the knee surgery and on those opioids, you were having crying fits. And so you'd be singing praise and worship one moment, and then suddenly you would just start crying out of nowhere. And it was like, oh my goodness, it was just the mood swings were unreal, none of that has happened this time.
No, back on those opioids, those heavy painkillers, I was in a funk all the time. I was looking from a cave, looking out, but I feel as sharp as can be.
So in saying all that, let's go do some PT, because that is also a big change from last time. That not only do you want to do your PT, you're like psyched to do it because it's so much easier because you're not in pain.
Right, so I can do all these things. I'm not overdoing it. I'm being very cautious. 3 or 4 times a day is all I'm doing.
That's what the paper says.
I'm being careful.
Look at this independence right now.
Yeah.
I really tried not to let him take on and off his sling by himself, and for the first 2.5 days I got it, but then he just took over.
So now I am not crazy, so I'm going to be gentle and put my arm down. There's no pain. I'm just being careful. There's almost a little tightness maybe. I'm even showering totally. I have this Tegaderm on there, so I can shower just normal.
Oh yeah, ew, gross. Nobody wants to see that.
Well, they want to, if you have the surgery. So I just shower normal. I'm crazy clean nut. I like showering twice a day. But anyway, So I do I don't use my muscles, but I use my body, and I do counterclockwise for 30.
Slow it down.
Very slow.
Okay.
For the film, I go slow normally.
He's just excited to show you.
Yeah, and then I do 30 clockwise.
Oh, I guess I didn't think about 2 different directions. That makes a lot of sense. Yeah.
And then I stand erect, my head up, and I do bicep curls, but just nice and slow. There's no weight in my hand, but there's no problem here. But I'm not going to have a frozen shoulder because I am moving around. And then there's something about wiggling my wrist. I guess that's for the people in all the pain. They can't do this. I have no.
There's so many muscles and tendons and all the things in your hand and arms. So.
Then I have this little ball I use. This is 4 times a day, and I do 30 of these crunches. Also in my sling, there's a rubber thing that I push on all the time or squeeze on all the time to keep this all fluid. And
yeah.
I'm in 3 or 4 more days. I see the doctor for my post-op checkup. I can't wait to hear what he has to say, and I can't wait to tell him about Journavx. Please give it to all your patients because it's a game changer.
Yeah. So I promise this is not a commercial. We're really impressed
No,
with it.
making money.
Yeah, nothing. So it's just really cool. And we wanted to share our story so that you won't be afraid to try something new, even though it sounds like, well, I don't know if anyone else has done this. Well, we have.
All right, thanks for watching.